Hello, everyone. Thank you for joining us to learn about ARTA and the ARTA Benefit Plans. I know you may have been expecting Jen today, but I've been tapped in, so I will be doing my best to fill her shoes. So let's get right into it. So the Alberta Retired Teachers Association, or better known as ARTA, was founded in 1963 and is a provincial association with over 33,000 members and 50,000 covered lives. ARTA has been the sponsor of ARTA Retiree Benefits Plan since 1995. Our provincial office is here in Edmonton, and we have a second office based in Calgary. We do take in-person appointments, but if that's too far to drive, if you're in Red Deer and you can't get to the Edmonton or Calgary office, and you would like to make an appointment, you can do so by visiting arta.net, where you can book a virtual appointment with one of our team members. As an ARTA member, not only are you eligible to join an ARTA benefit plan, but you will also have access to several membership advantages. There are wellness initiatives and contests held throughout the year, like the photo contest, we have a writing contest, as well as the perks program. There is an annual fee to becoming an ARTA member, so the affiliate education sector membership fee is $50 a year, which works out to just over $4 a month. We have a great discount program called ARTA Perks. We've partnered with over 100 businesses across Alberta that offer our members discounts across retail, restaurants, entertainment, travel, just to name a few. If you use your ARTA Perks discount card once or twice, your membership will already have paid for itself. So the ARTA Retiree Benefits Plan was created by a group of retired teachers who wanted a benefits plan that was more conducive to the retired lifestyle. We all know retirees love to travel, so they wanted to create a plan that included strong emergency travel coverage that they could take advantage of in retirement. ARTA is also a not-for-profit. Every dollar that comes into ARTA goes back into paying claims and ensures that we are offering the best benefits possible to our members. Some other plans will offer you a discount for joining during a promotional period. ARTA doesn't do that because we don't actually have any margins built into our premiums. So there are some eligibility requirements that you need to meet before joining an ARTA benefits plan. To start, if you are a retired instructor, academic staff, or support staff who have contributed to a pension plan like LAPP for 5 or more years, you are eligible to become an ARTA member under our affiliate education sector. If you become a member of ARTA, you must become a member of ARTA, you need to pay that $50 a year, but you gain access to all those membership advantages that we spoke about earlier and lots more. You also must be a Canadian resident and be covered by any eligible provincial or territorial health insurance in your province of residence. If you want to retire to another province, you can, and your benefits will follow you to every province except Quebec. There is no age minimum to becoming an ARTA member, and there is no termination age. The last we checked, we had a member who is 103 years old. So when you're looking at other plans, make sure to check for termination age because some will terminate you at 85. If you're an eligible ARTA member, your spouse is also eligible to take part in our benefits plan. If something were to happen to you, your spouse could continue their ARTA membership and continue receiving their ARTA benefits. So if you know you are retiring in the future, we encourage you to submit your application as early as 2 months ahead. If you retire and your spouse keeps working, you may decide to join their group benefits plan. However, just remember that you need to apply to ARTA within 60 days of losing your spouse's group benefits. Some people also decide to work in a different field once they retire and take those group benefits from that job. And just remember that once you lose those group benefits, you can still apply for ARTA. When ARTA receives your application, your coverage will be effective on the first day of losing your previous group coverage. So there will be no lapse in coverage. The day you indicate your previous group benefits end is the day that your ARTA retiree benefits will start. If you choose to wait until you retire to apply, eligible members must submit their application for health and emergency travel within 60 days of losing their group coverage or their spouse's group coverage. If you submit your application for health and travel after 60 days of losing group benefits, you will be subject to a medical questionnaire. So now I'm going to cover the different plan options that we have available. We have our comprehensive plans that offer a little bit of everything. They have some higher prescription drug maximums, emergency travel coverage, and some dental care. We created those comprehensive plans for members under the age of 65 who are not yet eligible for the Alberta Coverage for Seniors plan. When you turn 65, you are eligible to join the Alberta Coverage for Seniors plan, and that plan becomes the first payer of prescription drugs listed on the Alberta Drug Benefit list. And then we have our build your own plans. They are for members of any age. However, they were built initially to work directly in tandem with that Alberta Coverage for Seniors plan. And when you have an ARTA plan and the Alberta Coverage for Seniors plan, you can coordinate between the two of the plans and your prescription drugs will be covered at 100%. Okay, so let's get into our comprehensive plans, which, as I said, are available for those under 65. So we have 3 levels of coverage, core being the most basic and enhanced being the most comprehensive with the higher maximums. So all of our benefit plans include single, couple, and family care options, and the maximums are per covered person, meaning that each covered person receives the annual maximum and you don't have to share between you. You can always move up in coverage, but once you have moved up, you are locked into that plan and can't go back down for another 24 months. So I'm going to go through a few benefits that are covered under the comprehensive plans. But please know that all of the ARTA benefit plans cover a long list of benefits, and we would just be here all day if we went through every single one. We cover lots of benefits such as vision care, hearing aids, and a list of different medical aids and supplies such as CPAP machines and so on. So the overall coverage is 100% unless otherwise indicated. This means that you will be paid out at 100% when you submit the claim. The overall annual maximum for prescription drugs ranges from just the overall annual maximum general ranges from 10,000 to 15,000, which means that this is the maximum amount we will pay out in a calendar year. Most people don't actually reach that maximum. The prescription drug maximum is 80%, ranging from 1,500 all the way to 5,000 a year. So paramedical services are those practitioners that offer, for example, massage, chiro, counseling, and we cover 13 different practitioners. So those are covered at 80%, and our annual maximums are a little bit different from other providers. We offer an annual combined maximum, which means that you can actually choose to spend that annual maximum on whichever practitioner you may need. Most other plans have maximums per practitioner when you may not even use them. So we find that our members typically only use 1.8 practitioners a year. So we like to offer the flexibility to choose where you're using that coverage. Diabetic supplies are covered at $1,750 a year for those with diabetes that are insulin dependent. And our comprehensive plans include our 92-day emergency travel coverage with no stability clauses for pre-existing conditions, which I will talk more about, as well as supplemental travel. So our comprehensive plans also include some dental coverage. We offer 80% coverage for basic preventative and minor restorative work, while our enhanced health plan offers 50% coverage for major restorative work and 50% coverage for orthodontic work for any eligible dependent children. Our overall annual maximums range from $1,000 to $2,000. So those were our comprehensive plans, and now I'm going to talk about our build your own plans. These plans allow our members to pick and choose what they would like in a benefits plan, and you can be any age to join one of them. So these were built to work directly in tandem with the Alberta for Coverage Seniors Plan, which will cover 70% of prescription drugs listed on the Alberta Drug Benefit List. The co-payment you are responsible for is 30% of the drug cost, up to a maximum of $25. If you are 65 and have an ARTA Benefits plan and the Alberta Coverage for Seniors Plan, your drugs will listed on the Alberta Drug Benefit List will be covered at 100%. If you are not 65 and join one of our plans, ARTA will cover 80% of all eligible prescription drugs. So when you're building your plan, the first thing you need to do is choose an annual prescription drug maximum of either $1,500 or $2,500. If you're over 65, those maximums go a long way when used in tandem with the Alberta Coverage for Seniors. So our build your own plans offer two plans that do not include travel if you're planning to stay close to home, and those are HealthWise and HealthWise Plus. Then we have Total Health and Ultimate Health, which do include travel for those world travelers out there. With our build your own plans, we cover all of the benefits that we mentioned in our comprehensive plans, as well as many different medical aids and supplies. So on the right hand of the screen, Ultimate Health and HealthWise Plus plans offer some annual maximums for paramedical services, vision care, hearing aids, and they also cover some defined lifestyle drugs such as hair loss medications. We also offer 3 standalone dental care plans. You don't have to be enrolled in an extended healthcare plan to take advantage of these. You do, however, need to be an eligible ARTA member. So option A is the most comprehensive of the 3. With option A, you will receive 80% coverage for basic and preventative procedures, 80% for minor restorative, and 50% coverage for major restorative procedures, for example, crowns, implants, and bridges. Option B is the same, except there is no coverage for major restorative work. And finally, option C offers 65% of your basic and preventative procedures, as well as minor restorative. There are no maximums in place for basic and preventative procedures, while our minor restorative maximum is 750 and 1,600 for major restorative per calendar year. If you decide to add dental coverage as a late entrant, your benefit maximums will be prorated from your coverage effective date until next January 1st. So just like the extended healthcare plans, you can move up in coverage at any time. However, you are locked in for that 24 months until you can lower your coverage again. So ARTA has partnered with Green Shield Health so that all of our benefit plan members can access telemedicine. You connect with a Canadian licensed healthcare professional who can assess your symptoms and are able to prescribe medication right on your smartphone, tablet, or laptop. This is really convenient if you need to see a doctor sooner than your family doctor is available, or if you're trapped at home during a snowstorm, as we so often are in Canada. So you can also receive virtual counseling. Each covered member receives 5 hours of counseling, as well as 5 hours of couples counseling. So if you choose to take part in one of the 2 build your own plans that offer travel insurance or any of the comprehensive plans, you will have access to one of the best emergency travel plans in Canada. I say that because the ARTA travel plan is unique, as we do not have stability or pre-existing condition clauses built into our plan. Most travel insurance plans require a pre-existing medical condition to be stable for 90 or even up to 365 days. The ARTA travel insurance indicates that all travel-related medical emergencies must be considered sudden and unforeseen. So this means that you had no way of knowing a medical emergency would occur. So if you had a change in medication or are recovering from a previous medical episode and both you and your doctor feel that you are healthy enough to travel, go on your trip and enjoy it. And if something were to happen, you would be covered as the medical emergency would be considered sudden and unforeseen. You will also be covered up for $5 million per trip per person. And our travel plan also covers or offers $10,000 per trip per covered person in trip cancellation, interruption, and delay insurance. There are a number of reasons a trip would need to be canceled and covered, such as an illness or a natural disaster at your destination. And you can find a list of all the approved trip cancellation requirements on our website. With ARTA travel insurance, you will be covered for 92-day trips outside of your province of residence. So once you cross back into your province of residence, the 92 days resets. We have some members who like to snowbird in places like Palm Springs or Phoenix for the winter, although maybe now we're looking more at Mexico, who knows. What some ARTA members do is they find a cheap flight back to their province of residence, purchase a coffee, keep the receipt to prove that they have crossed back over the border, and hop back on a flight to their warm destination and enjoy another 92 days in the sunshine. So if you know that your trip will be longer than 92 days and are unable to return to your province of residence, you can purchase supplemental travel insurance in 15-day increments, all the way up to 212 days. So we prefer that you purchase your supplemental travel insurance before your trip. But if you're on a beach in Mexico and you notice that it's minus 40 back home and you want to extend your trip, you can call ARTA and ask to add supplemental insurance. We'll just ask you if you are past the 92 days or if you've made any claims on your trip thus far. And if the answer is no to both of those questions, they will most likely add the supplemental travel to your plan. If you decide to come home earlier, and you will be refunded any unused 15-day increments. So we have a great website. It's called artabenefits.net, where you can visit to check your eligibility, compare plans, and apply online. So there is a tool you can use that will help you build your plan by asking you a series of questions to determine the best plan options for you, as well as the premiums associated with each plan. And once you've gone through the plans, you can apply right online. So that's everything from me. If you would like us to send you an enrollment kit, please send an email to join@arta.net and we'll get one sent to you. It will include all of our plan options, the rates included, and an application form. If you have any questions, please use the Q&A. I know Jen has probably already been in there. Okay, not yet, but Jen can answer any of your questions. If you have any, I'll wait around for a little bit for those to come through. But otherwise, thank you so much for joining us and enjoy the rest of your day.